about 50% of the world population is now fully vaccinated. In Africa, this is just 10%. At the current vaccination rate, Africa is running too far behind. The coming months will be critical in Africa's effort to improve vaccination. The continent cannot afford to remain the fringe of this historic vaccination drive.
We are definitely experiencing a very large fourth wave of COVID, and 95% of all of these infections are of the Omicron variant, which is different to what we're seeing in North America. It's definitely the most contagious variant with a massive upsurge, rapid upsurge in cases. However, despite this massive upsurge in cases and infections, we're definitely also seeing the least of all severe COVID waves, with much less hospitalizations and much less ICU requirements. The reasons for this are multifold. So the first one that we suspect is that we have got quite a strong pre-existing seroprevalence of immunity in our population, and it's estimated to be around 70%. And this is likely due to previous infection from the second and the third COVID waves. However, we know that this protection wanes over a period of time. The second reason for having slightly less severe hospitalizations and infections is vaccination, although, as described earlier, our vaccination unfortunately hasn't been taken up as much as we would have hoped. And the third reason is that Omicron is likely a slightly less virulent strain.